Hello everyone, I'm Scott, your presenter for today's launch event. Time flies and Woodpecker proudly enters its 35th year amidst the rapid growth. Since our inception, we've led China's dental industry with a customer-oriented approach. Over these 35 years, Woodpecker has made significant strides and innovation in dental devices, expanding its reach to 140 countries and regions. Woodpecker boasts a wide range of products, spanning 15 categories. Among them, the scaler, which has the longest history, is highly favored by our dentist friends. Currently, over 2,300,000 scalers have been chosen by millions of dentists globally. Let's take a look back at the development history of our scalers. In 1989, we started to research and develop scalers. In 1992, we sold the first ultrasonic scaler. In 2003, we exported the first ultrasonic scaler. In 2015, we launched the first periodontal treatment device. In 2019, we released the first dental scaler and air polisher. In 2024, we introduced more prevention solutions. Having dedicated 35 years to the field of dental scalers, we've consistently explored ways to enhance the efficiency of dentists while ensuring optimal comfort for patients. Through market research and dental expert clinical insights, we've developed a comprehensive oral care solution, ABC. So, what exactly is ABC? This short video may simply explain. As is shown in the video, ABC stands for Airstream Biofilm Clearance, meaning a biofilm clearance oral care protocol. It holds the concept of prevention always treatment, emphasizing the control of biofilm in periodontal care. By using Airstreams, ABC efficiently removes biofilms, reducing the risk of calculus formation. Then, with ultrasonic scaling and polishing to further improve oral health. Let's now outline the ABC treatment steps. ABC offers 3 protocols: simple, moderate, and heavy. For moderate to heavy calculus, we follow a complete 10-step protocol. For simpler cases, we may ignore certain steps. Sharp tools make good work. To master ABC treatment, we shall start with a reliable dental scaler and air polisher, and then add in various auxiliary tools and materials, like intraoral cameras, biofilm disclosure, Airstream handpieces, ultrasonic handpieces, and prophylmotors, etc. It's their seamless integration that ensures quick and efficient clinical outcomes. After device preparation, now let's delve into the specific procedures of ABC. 10-step protocol. Step 1. Diagnosis. Every clinical case requires diagnosis. Before the operation, ask patients about their medical history, whether their blood pressure and blood sugar are normal, whether they suffer from heart disease, asthma, blood type diseases, etc., whether they are in their menstrual period, pregnancy, etc. Step 2. Biofilm disclosing. Using biofilm disclosure to reveal biofilm is a crucial step in ABC treatment. It helps to identify oral health issues in patients, enhancing doctor-patient communication and trust. Step 3. Supragingival airstream. using compressed air to drive powder mixed with water through an Airstream device onto the tooth surface. This process removes biofilm, pigment, and soft deposits, while polishing the tooth surfaces, restoring a bright and glossy appearance to the teeth. Step 4 and 5. Supragingival and subgingival ultrasonic scaling. After Airstream, we can perform ultrasonic scalar using titanium alloy types to remove residual supragingival and subgingival calculus. Combined with gentle vibration from Woodpecker ultrasonic alloy tips, it enhances patient comfort during treatment. Step 6. Supragingival Airstream. If necessary, we need to perform shallow supragingival Airstream to remove biofilm more precisely, and amino acid in the powder can also nourish your gum and prevent gingival recession. Step 7. Subgingival Airstream. In this step, you can use 14 micrometer Erythritol powder or 25 micrometer glycine powder to remove subgingival biofilm in periodontal pockets deeper than 4 mm, which also helps to nourish the gum with amino acid and prevent gingival recession. Step 08. Dental tubule sealing. After cleaning, we recommend using reminerous toothpaste to prevent cavities and enhance tooth hardness. Plus, polishing can make the tooth surface smoother and reduce biofilm adhesion. Step 9. Oral spa. Do oral spa gingival massage with green properly and wear an eye massager at the same time. It's beneficial to freshen breath, improve gingival elasticity and toughness, prevent gingival recession and periodontal diseases. Step 10. Recall. It's essential to stress the patient the importance of proper brushing and regular maintenance. Usually the recommended recall interval is 3 to 4 months. Thanks to the top-notch device and well-designed treatment procedures, our ABC protocol can be widely applied in various scenarios such as children oral care, orthodontic patients, and implants and restoration patients, etc. Additionally, we have put efforts in scaling like ABC branded bags and bottles. Moreover, we've ensured the quality dentists, clinics, trainers, and key opinion leaders have access to ABC certificates. As the ABC project gains momentum worldwide, it's clear that our efforts are yielding results. In conclusion, ABC represents a typical shift in oral care, guarantee prevention and comfortable with efficiency. We are confident that our ABC protocol will help maintain your oral health and give you a brighter smile. Thank you for your attention.